कल बर्थडे का है ना, बोलने 4-5 छुट्टी देखने के लिए।
You may start now, Nitin.
Yeah. Very good afternoon, doctors. It's an absolute pleasure to welcome each of you to the insightful webinar. We are honored to have such a distinguished gathering of medical professionals here today. Before we start today's discussion, so allow me to give just a brief intro about Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver super and innovative care. Hetero Healthcare have established 300 products in portfolio and are pioneers in quality and innovation. We have also launched 4 biosimilar products within 5 years in the market and have a strong global presence in over 126 countries. As you all know, today's topic is enzymatic preparation with Papain advantage in dentistry. To shed the light, we have privilege to have Dr. Satish Kumar Menon with us. So welcome, Dr. Satish sir. I'll just give a brief intro about Dr. Satish. Dr. Satish Menon is an MDS in periodontist with 10 plus years of experience. He is a founder of Kazan Dental and practices exclusively periodontology and implant dentistry. He has also published various papers in the field of periodentistry. He has a YouTube channel with 54,000 subscribers and Instagram page of 19,000 followers. He has also authored 2 books, BDS Launchpad and Dental Launchpad. So we welcome Dr. Satish Kumar. So yeah, session is handed over to you, sir.
Thank you. Thanks a lot. So is my presentation visible?
Yes, visible. Yeah, we can see it. Yeah.
Thank you. It's always amazing. कभी सोचा है क्या आपने कि every dentist, either on a Sunday or in the evenings or in the afternoon, from their busy schedule, take out time and come and attend such lectures. Many of you would have attended your clinic in the morning, again going to the clinic in the evening, and still you take out some time to try and upgrade yourself. ऐसा हम लोग क्यों करते हैं? Why do we dentists usually go and attend such CDE programs? Maybe half an hour, maybe 1 hour, even a full day event. And this is not only with young dentists. Even the senior most dentists do these things. Even after years of experience, we go and try and gain more and more knowledge. That's why you guys are here today. So why do we do it? If you ask various dentists that why do they do this? Why are they interested in upgrading themselves continuously and learning new procedures? You will get variety of reasons. कुछ लोग बोलेंगे कि मुझे ज़्यादा पेशेंट चाहिए, as in I need more number of patients. Some of them would tell मुझे ज़्यादा पैसा चाहिए, that I can take care of my family and my friends more better. And the rest would say मुझे basically respect चाहिए. I want more respect, satisfaction. When I go to sleep at home at night, I should feel I'm doing great work in dentistry. But where does this all end? इसका bottom line क्या है? Whether you want more patients, or you want more money from them, or you want satisfied patients, the answer to that is always having happy patients. Happy patients will make you feel satisfied, will pay more for your procedures, and will refer more patients towards you. So, हमें जानना है कि patient को क्या चाहिए. We have made up our mind that we want more patients, but what does our patient want? And it's not just one type of patient which walks into your practice. You would have the old uncle who might not have any teeth in his mouth, or might have a problem of all his teeth shaking or food getting stuck in between. You might have that young entrepreneur woman who might be managing the house, would be working outside also, and is concerned how her smile looks. On the other hand, there's this child जिनको उनके माँ बाप ने घसीट के क्लिनिक लेके आए, या उनको वहाँ पे सूजन हुआ है. ये बच्चे को क्या चाहिए? What does this uncle want? What does this young lady or man want? What does our patient want? A common joke among all of us dentists is, मेरे patient को सिर्फ discount चाहिए, सस्ता treatment, free treatment, and I'll have a lot of patients. But I want to ask you a question. Have you seen a practice जहाँ पे बहुत ही कम चार्ज करते हैं पर पेशेंट बिल्कुल नहीं है? And you see there are certain practices which are charging a bomb, बहुत ज़्यादा चार्ज करते हैं, and there are lines of patients always there. Haven't you seen those kind of extremes? I'm sure you have. If that is the case, is discount the only factor that you want or the patient wants? No. दूसरा आता है good treatment. You might have done an absolutely perfect root canal. The root canal is 0.5 mm short of apex. Patient is very satisfied at the day of obturation. पर 3 दिन बाद पेशेंट आके बोलता है मुझे बहुत दर्द हो रहा है. आपने रूट कनाल किया, मुझे दर्द हुआ. उसके आगे वाले दांत का रूट कनाल मैंने 4 साल या 6 साल पहले किया था, बिल्कुल तकलीफ नहीं हुआ. एंड व्हेन यू सी द एक्सरे, आगे वाला रूट कनाल विच वॉज डन 6 years ago बाई सम अदर डेंटिस्ट, उसमें आधा जीपी भरा है, यह एक अच्छा खासा परफोरेशन है, बट पेशेंट डज नॉट हैव पेन. सो पेशेंट को फर्क नहीं पड़ता है वेदर इट इज 0.5 mm शॉर्ट और 1 mm शॉर्ट. दे आर नॉट कंसर्न अबाउट द मार्जिन इज परफेक्ट फिटिंग और नॉट. सो वॉट डज आर पेशेंट एक्चुअली वॉन्ट? फर्स्ट, दे वॉन्ट फंक्शन. खाते वक्त कुछ भी तकलीफ नहीं होना चाहिए, जो भी खाना है खा सकते हैं. सेकेंड, लुक्स. कहीं पे भी बाहर जाए सब लोग बोले आपका स्माइल एकदम बढ़िया है. दैट इज वॉट दे वॉन्ट. थर्ड, they should have less or no discomfort. That is, during the procedure दर्द बिल्कुल नहीं होना चाहिए. आफ्टर द प्रोसीजर भी घर जाने के बाद कुछ भी तकलीफ नहीं होना चाहिए. So these are the three things. If we try and deliver to our patients will feel satisfied and happier. Now, for function and aesthetics, you will learn a lot of clinical things. But when it comes to pain and discomfort, one thing which we have been using since ages is prescribing medication so that there is no pain during or after the procedure. But why do we give this? Pain procedure के बाद क्यों होता है? The cause is inflammation. The meaning is to set it on fire. जैसे शरीर पे आग लग गया हो. Now, when it comes to inflammation, it can happen as a body response to anything. Either you put a chemical injury out there, you put a traumatic injury, give a cut, it can be bacterial, virus, anything. Any injury from the outside causes inflammation in the body. But inflammation में दिखता क्या है? What is absolutely seen there? First is swelling. Second is pain. Third is redness. Fourth is slightly गर्म होता है वो area, it becomes slightly hot. And in rare cases in dentistry, there is loss of function. Dentistry में where we see loss of function, mainly in the area of third molars, when the swelling is so much that the swelling obstructs the TMJ joint and the patient can't open their mouth. Or if you have a lingual swelling and the patient cannot swallow properly. Otherwise, the major 4 signs of inflammation जो हमें dentistry में दिखता है includes heat, redness, swelling and pain. So our aim is to try and reduce this. But should we completely stop it? Is inflammation actually bad? क्या ये बुरा है? The answer is no. Inflammation is basically a body response to trauma. It is trying to protect you. But if this protection runs over a period of time, then it can lead to various diseases like cardiovascular diseases, neurovascular diseases, and in rare cases, cancer. जैसे we tell ना, माँ बाप का प्यार बहुत अच्छा है. You want them around you. It helps you develop properly. But if it becomes excess, what happens? The child might become spoiled. Yeah, you're continuously in that restrictive environment. You do not want that. So anything in excess is not good for the body. Similarly, excessive inflammation for long durations is bad. So we want inflammation, but we want to control the procedure. But ये inflammation होता क्या है? What actually happens in an inflammation? अब imagine करो, you're driving through a road, आप रोड के बीच में से जा रहे हो, आपने रास्ते पे एक एक्सीडेंट देखा. क्या होता है एक्सीडेंट के बाद? बहुत सारा भीड़ वहां पे जमा होता है. Everyone wants to see कि हो क्या रहा है यहाँ पे. अगर कोई बड़ा आग लगा है या बड़ा एक्सीडेंट है, लोग अपने दोस्तों को बुलाते हैं, come and see कि क्या चल रहा है यहाँ पे. There is a complete rush out there. Similarly, उनमें से कुछ जन अच्छे रहेंगे. Someone would call the police and tell कि यहाँ से भीड़ हटाओ. Someone would call the ambulance and try and help जो इंजर हुए. कुछ लोग खुद वहाँ से जो इंजर्ड है उनको अपनी गाड़ी में लेके जाएंगे. Similarly, जब ट्रॉमा बॉडी में लगता है, when there is an injury, आजू बाजू के जो सेल्स है वो एक्टिवेट होते हैं. and they send out certain mediators. ये mediators जाके plasma cells को बुलाते हैं कि यहाँ पे trauma हुआ है, आके इसको ठीक करो. So what happens is जो बाजू का arterial supply है जो side से जा रहा है, वहाँ से various blood vessels blood cells come and try and seal that area. मतलब वहाँ पे एक पूरा seal करते हैं ताकि और inflammation नहीं आए. Others help in cleaning up the mess out there. So there are these mediators which are created by the cells which are present there, and some mediators जो खून से from the plasma cells they are derived. Now there are basically two pathways. One is cell derived pathway of inflammation and second is plasma derived pathway of inflammation. अभी cell derived में you have two जो पहले से already mediators है वहाँ पे, that is histamine and serotonin. The second one is newly synthesized, means जब इंजरी होता है वो सेल तब बैठ के बनाता है नए मीडिएटर्स ताकि वो मीडिएटर्स प्लाज्मा सेल्स को वो साइट में बुला सके एंड इन्फ्लेमेटरी सेल्स को. The other end you have plasma protein derived mediators in which there are two systems. One is the complement system and second is the factor 12 system. But point ये है कि as a dentist मुझे क्या, why am I supposed to learn all this? मुझे क्या फायदा है उससे? याद रखो, whenever a patient walks into your practice, what are their complaints? Trauma हुआ है, trauma हुआ नहीं है तो अगर दांत पूरा हिल रहा है, we remove the tooth. दांत नहीं निकाला, हमने सोचा कि तभी के तभी हम लोग इम्प्लांट डालेंगे, we drill the bone. सब ठीक है, हम लोग थोड़ा सा छोटा सा स्टिच दे रहे हैं, हम लोग we pierce through the tissue. In all these cases, we are creating trauma. This is basically the dialogue from Salman Khan. मारेंगे भी हमें, बचाएंगे भी हमें. We are creating short-term inflammation so that the patient has long-term lack of pain, has better function, and is able to get the aesthetics they desire. So we are creating small-term problems for long-term solutions. And the reaction to it is inflammation. पेशेंट का पहला हमेशा क्वेश्चन यही रहता है, डॉक्टर प्रोसीजर करते वक्त दर्द होगा क्या? विल आई हैव पेन ड्यूरिंग द प्रोसीजर? द सेकेंड क्वेश्चन दे विल आस्क यू इज, प्रोसीजर के बाद घर जाने के बाद तो दर्द नहीं होगा ना? सो बेसिकली देयर कंसर्न इज related to pain, swelling, and discomfort after the procedure and during the procedure. During the procedure, it depends on how good you are at your anesthetic technique, how good you do the procedure, how comfortable you make the patient feel. But after the procedure is done, the ball is no longer in your court. Patient जाता है अपने घर, वो खाता है उसको जो खाना है, आपने इंस्ट्रक्शंस दिए, फिर भी जितना वो फॉलो कर रहा है वो फॉलो कर रहा है. So you want to try and make things simpler and easier for the patient ताकि वो घर जाए, and post procedure they should have no discomfort at all. Remember, when a patient compares dentist, what do they say? वहाँ पे मैंने दांत निकाला था, मुझे ना बहुत दर्द हुआ, यहाँ पे मैंने दांत निकाला, बिल्कुल दर्द नहीं हुआ. फर्स्ट टाइप ऑफ कंपैरिजन. सेकेंड कंपैरिजन, वहाँ पे प्रोसीजर करने के बाद मुझे 3-4 दिन तक तकलीफ हो रहा था, यहाँ पे मैंने प्रोसीजर किया और मैं अगले दिन सीधा ऑफिस जा सका. बेसिकली दे आर कंपेयरिंग यू व्हेन इट कम्स टू हाउ दे फेल्ट ड्यूरिंग एंड आफ्टर द प्रोसीजर. एंड वन वे टू reduce this inflammation is by using certain enzymes. Now we are not trying to act on the hemostasis part. मतलब आपने दांत निकाला, कॉटन डाला, that's it, done, well and good. You want the blood clot to be there. Can you affect the remodeling जो 2 महीने 3 महीने बाद होगा, the bone formation? Absolutely not. You are trying to reduce the inflammatory phase. That is the discomfort the patient feels for the first 3 to 7 days after procedure. And this is where not just using regular painkillers, using certain enzymes is very helpful. Now, what do we mean by enzymes? Example, serratiopeptidase. Are we prescribing it or not? We are. Serratiopeptidase is also a type of enzyme which helps in reducing swelling out there. But imagine एक better enzyme है जिसमें combination है. It's just not serratio. It has 4 enzymes acting together which helps reduce the swelling. What do you think is better? The single enzyme or a multi-acting synergistic enzyme? Always a synergistic enzyme जहाँ 4 एंजाइम साथ में एक्ट करते हैं, यूजुअली इज बेटर व्हेन इट कम्स टू अ सिंगल एंजाइम इफेक्टिवनेस. And Hetero Healthcare has created one such enzymatic drug, which also has papain, that is known as Tolib. Now, Tolib करता क्या है और उसमें एडवांटेज क्या है? बेसिकली इनमें 4 एंजाइम्स हैं. लेट अस ब्रेक डाउन एंड अंडरस्टैंड व्हाट इज द एडवांटेज ऑफ टॉलिब, व्हाट आर दीज 4 एंजाइम्स और बेसिकली ये करता क्या है. द फर्स्ट इज ट्रिप्सिन. ट्रिप्सिन, अगर आप यू गो बैक टू योर फिजियोलॉजी डेज फ्रॉम BDS, यू विल रिमेंबर दैट it is created in the pancreas in the form of trypsinogen. मतलब ये ऑलरेडी शरीर क्रिएट करता है. It's not an extra new enzyme or something of that sort. It enters into the duodenum from the pancreatic duct, जहाँ पे वो ब्रेक डाउन होके ट्रिप्सिन में कन्वर्ट होता है. So if already body is creating trypsin, why should we give trypsin? Advantage क्या है पेशेंट को? It is shown that if you prescribe trypsin, first, it reduces vascular permeability. Second, it prevents and reduces inflammatory cytokine production. ये क्या है? Remember हमने स्टार्ट में बोला था, जब एक रोड में होता है, there's an accident by the side. What happens? There are mediators which are released and call all these inflammatory cells. So by reducing the mediators, you are preventing inflammatory cells from entering the site. First action. Second action. Imagine वहाँ पे पूरी भीड़ बन रही है. They are leaving the road and coming and crowding that area. If you have a police out there who tells them यहाँ पे भीड़ मत करो, keep on moving, keep moving across. Similarly, what does trypsin do? It reduces the permeability from the blood vessel. तो खून जो जम रहा है वहाँ पे, all the plasma cells cannot enter the site. It pushes it across so that the blood flow is continuously cleaning up that area. Second, it acts as a fibrinolytic enzyme. Fibrinolysis मतलब क्या? Initially, when you remember, हम लोग clot formation चाहते हैं. What happens is there are a lot of fibrins which go there and form a cluster out there which is extremely tight. But eventually you want to clean it up. सोच आपके घर पे आपने काम कराया. There is a hole in your wall. You call someone, they put cement out there, bricks out there, everything well and good. But जो बाकी का सामान है, after doing the entire work, they leave it there. How will be your area? It will smell eventually. It will be dirty, right? You want someone to take out the excess brick. You want someone to take out the excess cement. You want someone to clean up the area. Similarly, once you have clot formation out there, after the work of clot formation is done, the sealing of the area is done, you want that excessive fibrin to be cleared out. This is where trypsin comes in handy. Now we know that trypsin is an amazing enzyme. मतलब ये बहुत काम की चीज़ है. But शुड वी गिव इट टू आवर पेशेंट्स? किसी ने ये ट्राई किया है क्या पहले? क्या हम हमारे पेशेंट पे एक्सपेरिमेंट कर रहे हैं क्या? द आंसर इज आवर मेडिकल कलीग्स हैव बीन यूजिंग ट्रिप्सिन बिफोर. It has not just been used in regular cases, it has also been used in rheumatoid arthritis, diabetic cellulitis, and even in ocular disorders. Means they have used this medicine and they have found it advantageous. So अगर हमारे MBBS colleagues वो यूज कर सकते हैं, why can't we use this enzyme to help our patients heal faster? Now, Tolib doesn't just have trypsin. The other enzyme which it has is bromelain. Bromelain बनता किससे? Pineapple. Once you know it's from pineapple, you know it's a safe source. There's no problem with it. But why would you take out something from pineapple and prescribe it to your patients? The answer is there are multiple advantages to bromelain. Similar to trypsin, it prevents or reduces pro-inflammatory mediators. Second, it modulates the immune response by acting on cytokines. Third, it prevents platelet aggregation. याद है मैंने वो टाइम पे बोला था कि trypsin, once the fibrinolysis activity happens, it helps cleaning it up. Bromelain helps reduce that. मतलब कचरा बनने से पहले ही it tries and cleans up that area. So when you have advantages to bromelain, your next question should be, is it being used in patients before? And the answer is yes. MBBS doctors have already been prescribing this. It is used in various procedures. Even in certain cases, they have done a study where before the surgery, if bromelain was prescribed, it is seen that patients heal better and faster. It's commonly used in sports injuries as well. So when you know bromelain is useful, when you know our doctors are already using it, then why we dentists should be lacking behind? Why don't we prescribe it to our patients and see that our patients are also happier and better when it comes to post-procedural healing? The third enzyme is rutoside. Now, rutoside is found in buckwheat, tea, and apple. Again, naturally found sources. Advantages multiple. It has anti-allergic, anti-inflammatory actions. What does it do? It prevents platelet aggregation, increases vascular permeability, decreases vascular permeability, increases vascular flow. Now, this is a different property compared to the previous two enzymes we discussed. Improves vascular flow. What does it mean? Once the entire swelling area is cleaned up, you want that debris to be washed away. So it helps increase the vascular flow in that area so that debris, which is cleaned up from the fibrinolytic activity and everything, can be removed from the site, hence reducing the swelling post procedure. This also helps reduce edema in that area. It also has the regular effect on the mediators by suppressing interleukin 1 beta and tumor necrosis factor alpha. Now, similar to the previous two drugs, has rutoside been used before? Should I give it to my patients? And the answer again is yes. It has been used in various disorders and in inflammatory situations. And we have seen it is used in areas where a patient has an injury. You dress up the site, you want faster healing. Rutoside has been prescribed. And in such cases, they found that epithelium and healing was faster and better. So again, a drug which has proven itself in the medical side. The fourth and the most differential drug of Tolib is Papain. अब ये Papain बनता कैसे है? Have you seen pineapple, which is greenish in color, hanging onto the tree, which is not ripe? You're waiting for it to be ripe so that you can cut it and eat it. These same raw papayas, not pineapple, sorry, papayas are cut. There are slices given in it. और उसमें से there is a whitish liquid which comes out, which is known as latex. From that latex, this papain is derived. Now, once this papain is derived, it is then mixed with the rest of the three enzymes to come up with tolid. But why would you do so much effort? एक raw papaya ढूंढो, उसको काटो, use करो. The reason is, papain is one of the best enzymes when it comes to anti-inflammatory action. In front of you, you can see the long list. From not just strengthening blood vessels to anti-inflammatory effect, it also has antioxidant properties and improves microcirculation so that the blood supply in the area is there and all the debris from the fibrinolytic activity can easily be cleaned up. In overall, it reduces pain as well as it reduces swelling out there. Papain, like the previous three drugs, has already been used. And most commonly, it has been used in various ulcers like pressure ulcers, diabetic foot ulcers, leg ulcers. It is also seen to be very useful in cases of burns. So again, an enzyme which has been used by our MBBS colleagues, and we have seen it is very advantageous to our patients. Then why shouldn't we prescribe Tolid? Now, when I tell you all these studies which are done, you all will tell कि ये सब तो मेडिकल वालों ने किया है, डेंटिस्ट्री में क्या इसका फायदा है? इफ आई टेल यू कि मैंने मेरे प्रैक्टिस में यूज किया है एंड आई हैव सीन कि मेरे पेशेंट्स जल्दी हील होते हैं, यूल से वो आपके प्रैक्टिस में हो रहा है, पर इसका प्रूफ क्या है? द आंसर इज समथिंग नोन एज अ स्टडी. स्टडी में क्या करते हो आप 30 जन लेते हो या 20 जन या कुछ, उनको डिवाइड करते हो. आधे में नॉर्मल जो रेगुलर ट्रीटमेंट होता है वो देते हो और बाकी के आधे में आप नया कोई इनोवेशन ट्राई करते हो और दोनों में रिजल्ट देखते हो कि मेरे इनोवेशन में बेटर रिजल्ट आया है कि जो चल रहा है उसमें बेटर रिजल्ट है. सिमिलरली सविता डेंटल, उन्होंने क्या किया, थर्ड मोलार सर्जिकल एक्सट्रैक्शन पेशेंट्स जिनमें थर्ड मोलार अक्कल दाढ़ निकालना था, उनको ढूंढा. दे डिवाइडेड देम इनटू 2 ग्रुप्स. इन 30 दे प्रिस्क्राइब टॉलिब. 30 जन को उन्होंने टॉलिब दिया प्रोसीजर के बाद. 30 जन को उन्होंने उनके रेगुलर एंटीबायोटिक पेन किलर्स प्रिस्क्राइब किया. एंड दे डिड अ स्टडी टू सी हाउ द पेशेंट फील्स आफ्टर द प्रोसीजर. उन्हें क्या दिखा, जिन पेशेंट्स में दे हैड प्रिस्क्राइब टॉलिब, दे हैड बेटर हीलिंग, less discomfort, and less swelling. So we have seen when you divide patients regularly between those who you prescribe Tolib and those who you do not prescribe Tolib, Tolib patients show better healing post-procedure. So what are you waiting for? What is the advantage of giving Tolib? क्यों देना चाहिए? As we have already discussed, it is a synergistic effect. It is not just because of trypsin, it is not just because of bromelain, rutacide, and papain. It is a combination of all four of them which helps reduce capillary permeability, decreases edema, reduces inflammatory response, improves blood circulation, sees that healing is faster. And the best of all, Tolib is not made by a random company. You can trust it. जब भी आप कोई दवाई लेते हो, you need to be sure कि it is from a standard company. It is using standard material, and it is made by Hetero Healthcare, who have more than 100 countries where they export these medicines, and they create and produce medicines not just for themselves, even for other brands as well. So we know Tolib is effective. We know it comes from a standard company, so we do not have to be scared when we prescribe it. बट अभी आप कन्विंस हो गए कि टॉलिब देना है, बट किन पेशेंट्स में दे सकते हैं, कब दे सकते हैं, कितना डोसेज होता है? द आंसर इज यू कैन गिव इट इन एनी सर्जिकल केसेस, सर्जिकल एक्सट्रैक्शन, रेगुलर एक्सट्रैक्शन, इम्प्लांट सर्जरीज, गाइडेड बोन रीजनरेशन, पेशेंट को कोई जॉ फ्रैक्चर हुआ है, एनी केस वेयर यू आर एक्सपेक्टिंग एडिमा एंड इन्फ्लेमेशन, उसमें आप टॉलिब आराम से प्रिस्क्राइब कर सकते हैं. पर डोसेज क्या है? दे स्टेट दिन में 2 बार, as long as required. But usually हमारे dental patients को कितना टाइम लगता है? 3 days, 5 days, 7 days to heal. So you can prescribe 3 to 7 days depending upon आपने क्या procedure किया. If it's a normal extraction, 3 days or 5 days would suffice. If it's a surgical extraction, 7 days. If it's maybe a guided regeneration, bone regeneration procedure where you're done, you can give it for 10 days as well. So you can modify it depending upon what procedure you have done. But it is twice daily for as long as required. The next thing is it safe? क्या मैं सारे पेशेंट्स में बिंदास टॉलिब प्रिस्क्राइब कर सकता हूँ क्या? The answer is majority cases yes, but there are 2 contraindications. First is in patients where you are expecting bleeding to be excessive. For example, they are in warfarin therapy. Second, patients who are taking anti-sedative drugs, maybe due to psychological reasons or otherwise. These are the 2 reasons. याद है हमने स्टार्टिंग में डिस्कस किया था, bromelain prevents clot formation, excessive clot formation in extraction cases, surgical cases or inflammation cases. So wherever you are expecting bleeding to be an issue, for example in warfarin therapy or in cases where the patient is taking an anti-sedative, you should avoid giving Tolib. Other than that, which is not an actual contraindication, but काफ़ी research नहीं है, that is in pregnancy cases and in cases where the mother is lactating or feeding a child. In these 2 cases, we are not saying it is contraindicated, but since there is not enough research, it is better not to prescribe it. Other than these conditions, patient को क्या तकलीफ होता है अगर मैंने टॉलिब प्रिस्क्राइब किया? I want to take you back to your pharmacology. हम लोग किसके लिए, सबके लिए आंसर क्या लिख रहे थे? पेशेंट का ड्रग का साइड इफेक्ट, नौसा, वॉमिटिंग, डायरिया. सिमिलरली द मेजर side reaction or side effect the patient which might feel after taking Tolib or the TBPR combination is nausea, occasional gastric disorders and diarrhea. In sometimes, very rarely, the patient might feel some amount of weakness or fatigue. So this has to be taken care if the patient is on multiple drugs or for those cases. Otherwise, it is a very safe combination which you can prescribe in most of your cases where you want to reduce pain, swelling and inflammation. So what are you waiting for? We know that our end goal, whether it is more money, more patients or satisfaction and respect, is to have happier patients. We also know that happy patients want basically function, aesthetics and less discomfort during and post procedure. And one of the methods to reduce this discomfort post procedure is prescribing Tolib. So it is better we help our patients so that they are happier by prescribing them Tolib post procedures where we are expecting inflammation and swelling. So if there are any questions, I would like to answer them.
If you have any questions, you can type in the message chat box. Question, I guess this is from Sunil to see. Sunil to see. Is a apical of something material, meaning the patient should it be on different platform? This question is here in number two topic.
Uh, So डॉक्टर सुनील जी, आई एम अ पेरिडोंटिस्ट. मैंने लास्ट रूट कनाल 15 साल पहले किया होगा. ठीक है. सो मुझे नहीं लगता कि आई एम वेल इक्विप टू आंसर इट. जब मैं रूट कनाल करता था 15 साल पहले, अपाइकल पफ यूज टू बी कंसिडर्ड अ क्रेजी थिंग कि मतलब करना ही चाहिए, बहुत अच्छा दिखता है. बट आई थिंक द कॉन्सेप्ट्स हैव चेंज नाउ, और ये आंसर बेटर एक एंडोडोंटिस्ट दे पाएगा. मी बीइंग अ पेरिडोंटिस्ट नॉट डूइंग रूट कनाल्स, इट्स नॉट राइट फॉर मी टू आंसर इट.
Questions you can type in the chat box. That will directly reach Dr. Satish. He will answer it. If you have any questions, you can type in. Questions. So yeah, Dr. Satish, thank you so much for your time. Thank you so much for this insightful webinar, helping us understand college in a better way. Hope this will help all the participating doctors as well. Thank you so much. Thank you for your time.
Thank you.